the use of healing anesthetics in breast cancer. Hi there, my name is Dr. Walter Lamo, naturopathic physician who has a practice solely focused in cancer care for over 20 years. There's a paper that's been circulating, actually published from 2023, and of all places, it was published in the Journal of Clinical Oncology, where they were actually using an anesthetic called lidocaine, 0.5%, that was injected minutes before surgery in early breast cancer around the tumor area, and seeing if this had any outcome in decreasing the risk of this cancer from coming back and improving the lifespan. And sure enough, it did that. The study was actually published out of India. And so the study, what it reminded me of is actually a form of healing called neural therapy. It's actually, the birthplace was from Germany, where when you hear about like nerve blocks and that world, well, there was actually more to it. It was actually using it to help to regulate the nervous system, to balance out the nervous system. And not only lidocaine being used, but also procaine. So it's something in our practice that we've been using for many decades, and we use it intravenously as a tool to help regulate the nervous system. So think of it like in this concept, like acupuncture, how you put a needle in and it helps to regulate the nervous system. This is similarly, but you're using anesthetic. And so when you think about this procedure, where say they're going to go in and do a surgical procedure, which is a good thing, and yet, but you're trying to tell the body it's okay, like calm down that acute response, that acute nervous system response. Yes, there's been talk of maybe anesthetics having some anti-cancer properties and things, and maybe some other mechanisms. But in essence, and when you think of it in a holistic perspective, you're just trying to calm down that acute response, and which in turn could have a translation effect down the road. So it was really kind of great to see this paper. Of course, more research to come, but when you look at the statistics, like say the 5-year overall survival, so the group that actually had the lidocaine injected, their overall survival at 5 years was 90%, versus the group that didn't get that, it was 86%, 86.4. And so while you're looking at that, it's only a few percentage points, but you have to realize like chemotherapy is given for those reasons. Targeted treatments could be given. And so it's an interesting kind of paper that helps, that shines more light on trying to regulate that nervous system, which could have some translations of positive outcomes down the road.